All right. Good morning, everyone, and welcome to FWMD Live. Now, Juneteenth is this Saturday, June 19th, and today we are going to be celebrating Juneteenth with a conversation about Juneteenth and also discussing healthcare disparities still facing African Americans today. I'm Prescott Stokes III, the Integrated Content and Marketing Manager here at the TCU and UNT HSC School of Medicine. And today I am happy to be here with Dr. Velma Scantelberry for our conversation today. How are you doing, Dr. Scanselberry?
Great, thank you. Bye.
All right. I want to let everybody watching know that Dr. Scanselberry is a visiting professor of surgery at the School of Medicine. And Dr. Scanselberry is also the first African-American female to become a transplant surgeon in the United States. That is huge. And she also recently retired from Christiana Care's kidney transplant program, where she served as the associate director and the director of outpatient clinics. And she has been named to both the best doctors in America and top doctors in America list multiple times throughout her career. Now, I am also very happy to have a really special guest with us today. Mrs. Opal Lee is here and joining us. How are you doing, Mrs. Lee?
I'm doing real good.
Well, that is great. We are about to have a great discussion with Mrs. Lee and Dr. Scantelberry. I want to let everybody know that Mrs. Lee is a Fort Worth native, and many people across the country know her for her work petitioning U.S. lawmakers to make Juneteenth a nationally recognized holiday. Her Opals Walk to D.C. campaign in 2016 at the age of 89 helped garner her national attention. All across the country, she's walked her signature 2.5 miles, where she was invited to represent the 2.5 years it took enforcement of the Emancipation Proclamation to reach Texas, and that was to let all slaves know that they were actually free. In 2019, she launched an online petition in addition to her walking campaign that today has more than 1.5 million signatures. That is huge. And also, just another note, Mrs. Lee was also named Visit Fort Worth's 2021 Hospitality Award winner back in February. Now, if you want to be a part of our conversation, it's really simple. All you need to do is jump into the comments, leave your questions, and then I will definitely get you some answers from our guests. But before we get to your questions, I am going to begin this conversation with Mrs. Lee. So Mrs. Lee, yesterday, the United States Senate unanimously passed a resolution on Tuesday evening to recognize Juneteenth as a national Independence Day in America. So once you got that news and you heard that news, how were you feeling?
I was ready to do a holy dance, but I'm saving it for when the House passes its bill and it becomes law. I just don't know how to express it, because we waited so long and worked so hard to see Juneteenth a national holiday, and here it is almost at our fingertips. So, hey, I'm on top of the world.
That is wonderful. And as Mrs. Lee said, the measure needs to pass the U.S. House, and then it would be signed by President Joe Biden and it could become law. So that is huge news. So we're one step closer. We're almost there. But Mrs. Lee, what I did want to ask you is that in the past year with the COVID-19 pandemic, everything that happened to George Floyd last year, how have these events kind of helped your initiative and get more recognition to make Juneteenth a national holiday?
I'm wanting to know that the Black Lives Matter, those young people are asking for what we've been asking for years. You know, Dr. King made some progress. We inched along after that. The Million Man March gave us some leverage. And there are other, I guess you'd say, protests or what have you, where we've gained some, I guess, I don't know whether to say recognition, but we've gained something, but we haven't gained it all. And so we have a long way to go. And I'm hoping Juneteenth will be that bridge to take us over, because Juneteenth is about freedom. And none of us are free until we are all free. I know people wonder, what on earth is she talking about? We are all children of God. And he doesn't make any distinction of whether we're Black, white, Asian, Mexican, or whatnot. We're all his children. And the sooner we recognize that here in these United States, the better off we're going to be. We need to address the disparities together that plague us. And I'm talking about homelessness. Country's too rich for somebody to be homeless. Joblessness. Everybody who wants to work should be able to work. Healthcare. I can get my health problems attended to, but you can't. That's ridiculous. And I'm adamant about climate change. We are destroying the planet ourselves. I firmly believe that if we don't do something about it, we're going to annihilate ourselves.
And Mrs. Lee, I do want to take a second to talk about your Opals Walk to DC event that you have coming up in Fort Worth on Saturday at 10 a.m. to celebrate Juneteenth. And that's actually going to be live streamed by Fox Soul. That's a big network. So can you just tell us about what's going to happen at Saturday's event?
I thought you never asked. Last year, because we couldn't do a parade like we usually do, I walked 2.5 miles from the convention center to the Will Rogers complex, and people walked with me and cars followed. I thought we'd have 10, 15 cars. We had 300 cars. And so this year we're going to do it again. We're going to step off from the Evans Avenue Plaza and go to the county courthouse. That's 2.5 miles. And if we step off at 10, in LA, they're going to step off at 8. Atlanta, Philadelphia, New York are going to step off at 11. It's going to be simulcast. And we're going to see what they're doing. They're going to see what we're doing. There's going to be stuff in between, and it's going to be fabulous. And everybody in the United States can see what we're doing for Juneteenth.
Oh, that sounds so amazing to see everybody in all of those cities across America having that walk at the same time. So we are going to put the link to Fox Soul's YouTube page. That's where it will be live streamed on Saturday morning at 10 a.m. So that's going to be in the comments. And we also are going to put a link to Opals Walk to DC.com's event page, where you can get more information about the event that's going to take place here in Fort Worth on Saturday at 10 a.m. Now, this is FWMD Live. Today, we are talking about the celebration of Juneteenth coming up this weekend. And then also, we are about to talk about healthcare disparities facing African Americans. Now, we have one of the most prominent African American female physicians joining us today, Mrs. Dr. Scanselberry, the very first African American female transplant surgeon in America. So, Dr. Scanselberry, can you tell us about how important it is for us to have more representation in areas of medicine as a first step to improving healthcare disparities? All right.
Thank you for that question. We are definitely aware that African Americans in healthcare face so many disparities. And we know that a lot of those factors are outside our traditional healthcare factors. And these are what we call the social determinants of health. We need to take into consideration, where they live, if they're in food deserts. And these all play a role in why we see these healthcare disparities. And so it's important that when we think about these conditions, we need to think about the proportion of underrepresented minorities that take care of people of Black and brown color. And it's important because we need to integrate within the healthcare workforce those cultural diversity, the cross-cultural education is important for us to recognize that amongst ethnic groups, there is significant diversity when it comes to values and beliefs, and understanding that those values play a role. And so the cultural awareness of the population that we serve is important, that those of us in healthcare look like them, understand their background, understand where they come from, understand the issues that they're facing, and not just see things on the surface. Oftentimes our physician says, here's this medication, go home, I want you to eat better, eat more fruits and vegetables and change your diet. Well, if they live in a place where they don't have access to that kind of stuff, then how are they supposed to get those kind of ingredients? And so it's important to really bring all these components into our healthcare. And so it's important to have culturally sensitive healthcare workforce, as well as those who understand the background and the issues facing people of color.
And Dr. Scanselberry, African Americans have a higher mortality rate than other races for all cancers in America. So what are some things that we can do to kind of change that dynamic? Because cancer is such a serious health issue.
Absolutely. And collectively, African Americans have the highest death rate and the shortest survival for many cancers in the United States. And this is for when we look at all ethnic and racial groups. And Black men also have the highest cancer incidence rate. So it's important for us to know our risk factors. African American men are 1.2 to 1.5 times more likely to be diagnosed with new cases of cancer, colon cancer, and prostate cancer. And so, African American women are more likely to be diagnosed with stomach cancer, 2.2 times more likely to die from stomach cancer compared to non-Hispanic white women. So those things are important to know. And there are several factors that contribute to that. When we think about socioeconomic status, how that brings about poor access to appropriate health care. When it comes to preventive and early detection measures, cancer screening is important. And so it's important that you have knowledge of what your risk factors are, and important to us, as Black people, we tend not to want to go to the doctor. We don't want to know what's going on with us. Those things are important. And also understanding that there are services out there that can help you navigate the system. And so we need to be aware of our risk factors. We need to find out how we can take our elderly to the doctors, and also for ourselves, looking at what are our own health factors and what we can do to change that dynamic, understanding our risk and being advocates for our own health.
That is wonderful information, Dr. Scanselberry. I just want to let everybody know this is FWMD Live, and today we are talking about Juneteenth celebrations with Mrs. Opal Lee, and we're also talking about healthcare disparities that are still facing African Americans with Dr. Velma Scantelberry. Now, as we move on, you can leave your questions for Dr. Scanselberry and Mrs. Lee in the comments, and then I will definitely get you some answers from them. But right now, we want to take a second to look at a video done by TCU. So this is the Remembrance and Reconciliation, the story of Fred Rouse, and it commemorates the memory of Mr. Rouse. And there are local efforts going on by nonprofits in Fort Worth to buy a building where Mr. Rouse was lynched. Let's take a look at that video and see.
You cannot walk away from this experience today and not act. You are expected to act after you learn about the life and legacy of our dear Mr. Fred Rouse.
Fort Worth Lynching Tour honoring the memory of Mr. Fred Rouse is a bike and car tour to the sites associated with the lynching of Mr. Fred Rouse, which occurred on Sunday, December 11th, 1921.
My name is Fred Rouse III, and Mr. Fred Rouse is my grandfather. The very first time I took the tour, it was heart-wrenching. I could not believe that somebody would do this, not only to my grandfather, but to any human. It just broke my heart.
Mr. Fred Rouse was a non-union strikebreaker in the Nile City stockyards, and when he left work on Tuesday, December 6th, 1921, he had to walk through a throng of white picketers. That evening, he was attacked and left for dead in the stockyards. The police officers put him in the back of the car. They thought he was dead. In fact, he was alive and rose up from the back seat. And so they drove him to 4th and Jones Street, the former City and County Hospital, and he recovered there from his wounds, which included stab wounds, and his skull was fractured in 2 places, along with internal injuries. And on the evening of December 11th, 1921, he was kidnapped from the hospital and was driven to the site of the lynching, which is at Northeast 12th Street and Samuels Avenue, and was murdered there at approximately 11:15 that evening.
As long as I've lived here, I've never heard about this story. And so I had to come out here and learn more about it and really just educate myself so that I can educate other people about the story. At TCU, we talk about the university being the University of Fort Worth. If we're going to be the University of Fort Worth, we have to tell these types of stories.
I come to this work with a sense of responsibility and with a sense that change can actually happen in our lifetimes. What this work has meant for me is that I also get to invite others to take leadership in the change that we want to see here in Fort Worth. And I see it happening. Hundreds of people have participated in this tour, and we hope that in the future, hundreds more will also have an opportunity to move through these spaces to better understand the effect of racism on our current communities.
They thought they killed the man, Fred Rouse. They thought they killed the name, Fred Rouse, and they thought they killed his legacy. But that was only the beginning, because 100 years later, not only are people still honoring the name Fred Rouse, but a living witness, I'm standing here, I'm Fred Rouse III, and I also have a son, and his name is Fred Rouse IV. With them executing my grandfather back then only sparked the beginning, because 100 years later, his name and his legacy still lives on to this day.
All right, now you can read more about that story about Fred Rouse at magazine.tcu.edu. Mrs. Lee, we saw that you were a part of moderating a discussion during that Fort Worth lynching tour that TCU put on a month or 2 ago. Can you just tell us about speaking about the importance of Mr. Fred Rouse and his story to the Fort Worth community?
I can. The Rouse incident, really not the only one that happened in Fort Worth. There were others. And my family incurred the wrath of some 500 people. The paper said my parents bought a home in a neighborhood where they didn't want us, and they burned the house, tore up the furniture. And I know others, my parents sent us to friends several blocks away, and they left under cover of darkness. Other families suffered too in Fort Worth. Not the lynching that Mr. Rouse did, but there were other atrocities. And I'm one person among several who are trying to get that building that's, you see Ellis Pecan, that's what they used, but it was actually built for the Ku Klux Klan. And that's what's under that sign. We want to take that building and make it into something positive. We want people to remember Fred Rouse and what he went through, and others who have suffered indignities or worse. So we advise you to go to the links, and I don't have them in my head, where you can contribute, where you can be a part of what's going on at 1012 North Main Street. I'm hoping that people understand that we must move forward. We must be vigilant that these kinds of things don't happen again. And that's why we want to take that building and put positive. There's several nonprofit groups that want to make that building into something that people will be proud of.
And thank you for that, Mrs. Lee. We're going to share some links in the comments about that. And I just want to let everybody know that you can join the TCU Alumni Association and TCU Magazine on their Facebook pages on Wednesday, June 30th at 1 p.m. for a panel discussion called Never Too Late to Say His Name. Opal Lee will join TCU Professor Adam McKinney, Alumni Board President Tracy Williams, and Fred Rouse III, the grandson and the only documented victim of racial terror lynching in Fort Worth history. And so we will have Brandon Kitchen guiding everyone through that important conversation about why we need to acknowledge the more difficult aspects of Texas history. So we have some information in the comments about that. And that should be a great discussion coming up on the TCU Alumni Association's Facebook page and also TCU Magazine's Facebook page on June 30th at 1 p.m. So today we are talking about Juneteenth celebrations with Mrs. Lee, and we're also talking about healthcare disparities facing African Americans with Dr. Scanselberry. And I just want to talk a little bit more about healthcare disparities, Dr. Scanselberry. There's a recent study from the Center for American Progress that showed that 12.1% of African Americans in America are under 65 were uninsured. How important is it for African Americans to make sure that they have healthcare insurance?
Thank you so much, Prescott, for that question. And we know that health insurance matters when it comes to seeing doctors, seeing specialty doctors, receiving specific types of treatments, and even in just getting preventive health care. And that is so important. And we know that those who are uninsured and lack insurance tend not to seek out medical care because they feel like they will be rejected. But we also need to realize that the expansion of the Affordable Care Act in 2014 significantly increased America's ability to get health care since the law was put in place. And African Americans and Hispanics have the highest rates of uninsurance prior to 2014, and they have experienced the biggest gains in insurance. So the uninsurance rate in 2013 for Black adults dropped from 24.4% in 2013 to 14% in 2018, and then now to 12%. So we have definitely made good strides when it comes to getting insurance, but we also need to do more when it comes to preventive care and also getting those who are uninsured the appropriate care that they need. And we know that even with health insurance, we still face healthcare disparities, even if we're insured, even if we have private insurance, how we're treated, whether or not we receive the right treatment, early diagnosis and treatment. So we have to know more about our own health, and we have to advocate for our own health with and without insurance.
And also, Dr. Scanselberry, I just want to ask you, what are some steps that African Americans can take to reduce some of these healthcare disparities, and that would actually be helpful for their physicians when they do get in to see a doctor?
Absolutely. And I've been advocate of health literacy because we really need to understand more about our risk factors. Those risk factors play such a great role in our long-term health. And so you need to understand, what are you at greater risk for? What is your family history? How can I improve my overall health? Am I at risk for diabetes based on my family history? Have I gotten the appropriate blood work for that? Getting that information, understanding your risk factors, smoking and the association with cancer, alcohol and its risk factors. And so when we see our physicians, we want to ask questions about how we can improve our better health and improve our long-term risk for minimizing our long-term risk for worse outcomes. And so the more we can do about advocating for our own health and advocating for the health of our loved ones is very important. So we need to take control of our own systems, our own ability to access healthcare, and for us to really look out for our elders and other family members to make sure that we're all getting appropriate health care and asking the right questions.
All right. So when you get in to see a physician, just be able to ask the right questions and have a little bit of information about your family history. That's wonderful information from Dr. Scanselberry. So this is FWMD Live. Today we are talking about healthcare disparities that are still facing African Americans, but we are also talking about Juneteenth celebrations that are coming up this weekend in Fort Worth with Mrs. Opal Lee, Mrs. Juneteenth herself. So Mrs. Lee, you were also just named, well, actually you had this beautiful spread in Southern Living. We're gonna put a link in the comments to that, looking fabulous for the cover of Southern Living magazine, but you have also been named as a guest for Variety Magazine's Changemakers Summit that's gonna take place on Friday with Grammy Award winning music producer Pharrell Williams. That is amazing. So I just want to know, how has it been for you to see so many young people and so many celebrities and media outlets embrace this movement and give you a platform to talk about Juneteenth?
I'm delighted. I really am. I love young people. And I want you to know, you are young people. If you're not 94, you're a young person. And so I'm delighted that they are listening and that they want to take up the calls, because it's going to take every single one of us to get this over to the rest of us, that we're all brothers and sisters under the skin, that we're all having the same problems that the doctor talked about, which includes housing and health care and joblessness. All these things need to be addressed. And there's absolutely no reason for a country as rich as this to have those kind of disparities. So I welcome young people. I welcome Pharrell and P. Diddy and Brim and all these young folk. I'm so glad that I know them, and I wish I could hug them all at the same time. But I'm glad that they are taking up the cause, and they're getting those young people they know to understand that we are all in this together. It's going to take every single one of us to get it through, that we too are first-class citizens, and we want what first-class citizens are supposed to have.
All right. Thank you for that, Mrs. Lee. And actually, I will be watching on Friday as well. And we're going to put a link to Variety Magazine's event registration and info, so you can get yourself signed up to make sure you can watch Mrs. Opal Lee talk to Pharrell Williams about Juneteenth and all of her efforts. So that is really huge. And we appreciate you, Mrs. Lee, for representing Fort Worth and also, representing the African-American community in such a positive way and pushing for things like this. We need people like you. We need young people to step up and follow in your path and continue to fight. So I am just delighted that you were here to be with us.
I'm delighted too.
Thank you. And on that note, that will do it for today's live chat. I want to thank everybody on Facebook for being a part of today's conversation. And I want to give a very, very special thanks to our guest, Dr. Scantelberry. Thank you. And Mrs. Opal Lee, thank you for taking the time out to join us and talk to us about Juneteenth and healthcare disparities today.
Thank you, sir.
Thank you.
Thank you, young people.
Thank you, Mrs. Lee.
All right.